Good afternoon. Thank you very much for your attention and the possibility to present this work. Um, these are my disclosures. We know that it was said last century that the urine was sterile, but nowadays the concept has a bit changed, and we talk about the urinary bacterial flora that can be disturbed, and then we get a microbial dysbiosis. So the aim of this study was to see if there was any relationship between the appearance of any of the lower urinary tract symptoms or prolapse and this change in the microbial urinary profile. So it was a cross-sectional study of 94 women who underwent a urodynamic study between April 2017 and March 2018. The mean age was 36 years old, and we took the midstream urine that was collected, and it was cultured for 24 hours, and it was prolonged until 48 hours. The patients were fully investigated of the presence of these urinary tract symptoms, but also of the presence of pelvic or organ prolapse by the gynecological department. In the same session, those patients underwent the urodynamic study according to the ICS practice. The first thing that caught our attention was that if we had the culture an additional 24 hours, we get more cultures that were positive, especially for emergent uropathogens. If we have a look at the symptoms, patients attending because of urgency of urge incontinence had more frequently classic uropathogens and cutaneous mucosal flora. Those patients with intermittency had a greater frequency of classic uropathogens and emergent uropathogens. And this was the same thing for patients with slow urinary stream or recurrent urinary tract infections. However, if we focus on patients with pelvic organ prolapse, on one hand, those patients not having prolapse or only a grade 1 had a greater frequency of cutaneous mucosal or vaginal flora, and those patients with a prolapse greater than 2 had more classic and emergent uropathogens. Those patients with stress urinary incontinence or detrusor overactivity or other urodynamic findings didn't have any particular pattern or profile of dysbiosis. So we concluded that in this sample of patients, the vaginal and cutaneous mucosal flora play a role in the presence of these lower urinary tract symptoms or prolapse, but up to now, the role of the emergent uropathogens is poorly understood and have to be more developed. Thank you.
So one question that I had is, classically, it's always taught that a catheterization, you're more likely to get a non-contaminated specimen. So I'm just curious why you chose a midstream.
This is the most usual practice, I think. No, usually you don't catheterize the patients to analyze the urine in a usual. So I mean, and perhaps if here most people here in the audience would have a specific urogynecological office, but for having this in a more practical way for other urologists or gynecologists, it's usually patients are asked to get their urine by the midstream. So I think it would be more useful for everyone.
Vaginal
moisturizers or estrogens?
Just
So the average age of the patients were 36. So maybe there were some patients.
36 with significant prolapse.
Mm-hmm.
can you repeat
Oh,
the?
66,
No, so
sorry.
from the whole. So
I just wondered, did the audience hear the question?
Sorry,
No. So can you repeat it?
Sorry,
please?
yeah. It was just to look whether the patients had had topical vaginal estrogen or vaginal moisturizers that might have affected the biome, and had they taken that into account?
And you said,
It wasn't analyzed here, but
Okay.
I'll ask the colleagues to look at this because, of course, it's a very, very interesting question. And it has been already published that the local estrogens in postmenopausal women clearly change the microbiome of the vagina, especially, and also from the urine. So that's really, really interesting. Thank you.
any other question? I just wonder what happens if you culture it for 3 days. Is there any other interesting?
We don't know it. We just cultured it for 48 hours. Maybe you can get any other. That's why we still use these emergent uropathogens, no? This concept,
Yeah.
because it's true that the type of pathogens we found with Wixella and all these things, they mainly are with the 48 hours. So
Okay.
that's what we know. If we
Yeah.
get any other in the future, we'll
Come back.
just just come back and tell you.
It all depends if you cough on it or not. Okay, thank you very much.
Thank you.
So the next